Well, welcome to this joint CIPD and CIPP webinar, which explores the changes to statutory sick pay, which is taking place this April. I'm your chair, Charles Cotton. I'm the Senior Policy and Practice Advisor for Reward at the CIPD. Now, the next slide is the speakers. Now, I'm delighted to be here with the speakers and yourselves today to explore this important topic, which is impacting both our respective professions, both the payroll profession and the people profession. Now, I'm going to ask today's speakers to introduce themselves at the start of their respective contributions. And before I go on any further, just a few housekeeping notes to let you be aware of. So this session is being recorded and will be available on demand via the CIPP and the CIPD websites respectively. Today, to submit questions to the panel, please use the question and answer function on the webinar and not the chat box, as this won't be monitored as closely. However, we're encouraging you to use the chat box function so that you can network with fellow attendees. And also use all panelists and attendees to share with everyone. On top of today's session, I'd also like to remind both CIPP and CIPD members of a number of respected member benefits. So CIPP members can access exclusive benefits, including use of the advisory service, access to the policy team, upcoming Be Connected events taking place on both the 26th and 27th of February, which are CIPP's new tax year updates. Not only that, but you can gain access to discounts and training courses and events and receive digital badges to promote your professional status. And not to be outdone, the CIPD members can also get individual legal advice on our HR Inform helpline, and it's available 24/7. And included in your membership, CIPD members can also access our Wellbeing Hub with a helpline brought to you by Spectrum Life. Members can access free help and support 24/7 throughout 365 days a year via telephone, live chat, WhatsApp, or email with vetted and qualified accredited counsellors and physiotherapists. And members can access the phone number and the online services via the membership benefits webpage. Now, today's session focuses on the upcoming changes to statutory sick pay taking place this April under the Employment Rights Act, which was recently passed towards the end of last month. Eligibility to statutory sick pay will be extended to around 1.3 million low-waged people in the UK. Now, while these reforms are an important step towards fairness and improving financial well-being, they also create new considerations for workplaces, particularly for HR and payroll teams working even more closely together. Throughout this webinar, we'll be exploring what the SSP changes mean in practice, how payroll teams can prepare for increased eligibility cost and systems impacts, and how people professionals can adopt more preventative and consistent approaches to managing absence. Now, just a quick reminder of the running order. We'll shortly be handing over to Samantha O'Sullivan to explore the impact on these changes for payroll professionals, followed by Rachel Suff to explore how the people profession can prepare for this change. And at the end, we'll have opportunity for some questions on this topic. But first, I'd like to hand over to Amanda Chadwick, who will give a little bit of context setting and outline the incoming changes set out in the Employment Rights Act 2025. So over to you, Amanda. Thank you.
Thank you so much. Thank you very much indeed. I think many of you may have met me if you haven't or seen me. My name is Amanda Chadwick. I'm a speaker, and today I believe that I'm representing all the HR people out there, that this will create and payroll workers create a lot of work for, I feel. And this is a really fantastic webinar because we have experts. We have Rachel and Samantha on that are going to delve in it into great detail for you. So I'm going to give you a little bit of an overview. And then what I'm going to do, I'm watching the time as well because I think I've got about 10 minutes. So I'm what and I do talk for, as you know, for the whole of the UK. But I think that I'm just going to give you an overview because Rachel and Samantha will delve into it a little bit more as experts in the absence management side, but also from the CIPP perspective as well, which you've got the opportunity with the great experts here. For me, and this particular legislation, I know that it will affect a lot of employers and it is down to management. And that's something that will be covered later on, and about absence management. And I just want to say that sickness absence is at a 15-year high, and work related ill health costs the UK economy over 400 million pound a week. I think a lot of that is down to also not managing it properly. I meet so many companies that don't manage it properly, and so the tips you're going to get are going to really help. Employers lose on average 120 pound a day in profit from sickness absences, and tens of thousands of pounds replacing staff. I absolutely love employee assistance programs. If you've listened to the webinars and mental health and you've read my stories on LinkedIn, you'll know that for me, that was life changing. And I think EAPs are fantastic because when you're in HR and you have people that are have issues and problems, we have enough on our plate. And I'm great, I have empathy, but I would like to point people in the right direction for well-being and support and counselling and advice about money. And if they and advice about everything from debt upwards. And I think this is the problem you see with sickness. If that if you are off sick and you weren't getting that 3-day payment, and you had bills to pay, you get worse, more into debt as you go along. So for me, EAP, well-being strategies, effective absence management are absolutely essential and can be used to reduce absent levels. And again, that's something that will be spoken about later on. Government plans to reform SSP will put more emphasis on management and also working with managers. And I think you're seeing this in the Employment Rights Act. There's this collaboration. We've got payroll, we've got health and safety, we've got employment law, we've got HR. We're all working together and collaborating to make this work for companies. And we're losing so much money. So our government plans to reform the SSP will put more emphasis on absence management processes, the training of managers to know how to implement that as well. Not realistic to remove all absence, sickness absence, but can support employees to keep absence to a minimum. And the TUC analysis from the March 2025 of data from the health and safety, so many crossovers with health and safety employment law. They're joined at the hip. Pregnancy, return to work, working time regulations, harassment, all contribute to this health issue that we've got. So shows that work-related ill health costs the UK economy over that 400 million mark. And it is estimated, and I say this sadly, but for those earning low workers, like my mum was, many children, many jobs. She couldn't take time off sick because she couldn't afford it. It's estimated that currently statutory sick pay costs businesses around 650 million per year. That's in 2024-25 prices. That's a cost of about 23 pound per employee. So it is about management here. It really is. Samantha will talk about that. So SSP update, what's happening? What are the changes? So there's a flat rate will increase from £123.25 from £118.75 per week, where the 3-day waiting period, which I've had so many questions about, and the requirement to earn at least the lower earnings limit will be removed. All workers to be paid SSP from the first day of absence. So people are confusing that. Like, I get that immediately if I just have one day, first day. don't get confused, we're going to cover that shortly, but at a rate of 80% of their weekly earnings, or the flat rate, whichever is lower, which will mean some workers will be paid less than under the new rules, which I know that will be unpacked throughout this webinar. So under the Employment Rights Act, significant changes to SSP eligibility will be going ahead with an expected implementation date of 6th of April. Those changes will see the requirements to earn the lower earnings limit and to serve those 3 waiting days before receiving SSP removed. So we're really, I think, helping those people that have in the past never ever received SSP. That's who we're helping. And this means absence management is going to be so much more important. So if we go to the next slide, why the change? Why the overview? There are 1.3 million low paid workers that are not eligible for statutory sick pay. There are parents there are part-time workers. And I use my mum, I was thinking about this actually, and I use my mum as an example, a mother of 6 children, and then 7. She actually adopted a child as well. So we're 7 children. And then my father in the Royal Marines, away quite a lot, not great money for many years. And my mum had jobs that fitted around the children, so she'd have a few jobs. We're helping those people. So no employee receives statutory sick pay for absences less than 4 days. It can force people to work when they are unwell, which may delay their recovery. So without this, what people do is work through that illness. People get that spreads infectious diseases at work, and changes will support all employees to take the time off they need to recover by providing better financial security and not worrying about the bills to be paid. That is why the change has happened. That's why that's happened. I've come to my final slide, but I wanted to read out, because I think I've got a couple more minutes. I just want to read out some of the questions that I had the other day, which are just a couple of the regular ones when we did a webinar on this on Monday. But what the questions we have is, what evidence can employers request for short-term sickness absence? And I know that we're going to cover the procedure and return to work interviews, the importance of health and safety. But short-term absence, employers can continue to rely on that self-certification for short absences, typically up to 7 days. For longer or repeated absences, what we have is employers may request medical evidence, but must do so reasonably and proportionately, avoiding unnecessary barriers to SSP. Also, can SSP was one of the big questions, was can SSP be withheld if the employee does not follow the absence reporting procedure? Because we're really focusing on that absence reporting. Yes, in limited circumstances, employers can, just so you know, enforce that reasonable reporting procedures, but SSP should not be withheld automatically. Any decision must consider whether the employee's had a genuine reason for late reporting. So it is that return to work interview to find out why. Consistency of application, and for each of these I've got just a few minutes, and I know that I'm conscious of that, but there's loads of examples I can give you of this and stories. But consistency of application, risk of discrimination or unfair treatment, and a blanket no report, no pay approach is pretty risky. So, and we're going to talk about, I think, contractual sick pay later on, but just double check your policies and procedures here. And remember, this is changing. This is huge news for employers, and I'm sure that the payroll systems will be covered shortly, and the work that needs to go in there. But return to work interviews after 1 day, health and safety side, which quite often gets missed out. The importance of that is because we don't know what's happened the night before. So if you're doing return to work interviews, you're doing it for health and safety, and you're doing it for managing the odd day people, but also long-term absence and fact finding and show you care. The health and safety side, because you don't know what medication people have taken, and it's very, very important to do those and have that medical statement that says, if you have a medical condition, if you start taking tablets, you are taking tablets, they change, you're having counselling or something's happened, you have to let us know, written at the earliest stage possible. Have that in your handbook, have that in your safety handbook. I want to cram so much information in here, but I'm handing on now. I'm passing on now to I'm sorry about this, I'm passing on, and but CIPD HR Informed platform can really help you with the advice and letters and contracts. So thank you very much.
Amazing. Thank you, Amanda.
Oh,
Like
sorry,
you said,
Samantha. Yeah, thank you.
no, that's absolutely fine. There's so much to cram in,
Oh,
isn't there? And we could all
yes.
probably take an hour just to ourselves. But thank you. I'll take the baton from you,
Yeah,
and
there you
I'm going to go into,
go.
I'm going to cover what we need to know from a pay point of view. So my name is Sam O'Sullivan. I'm the Policy and Advisory Lead at the CIPP. And I actually delivered a session on this to CIPP members back in November. And I have to say, we delivered a session on it because we wanted to address, we are working on it. We're closely working with DWP alongside CIPD. But it was a bit of a no news update, and we're fully aware of that. It was a no news update, even though I knew what the news was, but I wasn't allowed to tell you at that point. So I'm delighted that now the cat's out of the bag. We can talk about what the changes will be. So let's head on in. So as Amanda stated, the new rate of SSP, the new flat weekly rate of SSP from the new tax year is going to be £123.25, or 80% of the employee's average weekly earnings, whichever is the lower. Now, I've shown this slide because it catches a lot of people out. The SSP is a weekly rate, regardless of how many days a week somebody works. So that means somebody could work 1 day a week. Their daily rate of SSP will be £123.25. We get this question an awful lot into the advisory service. Well, if someone only works 3 days, is it the flat weekly rate divided by 5 and then paid by 3? It's actually a full weekly rate. It's a statutory payment. And we would not ask this question if, for example, it was statutory maternity pay. We wouldn't be proratering that flat weekly rate for someone who only works a part of a week. So the same applies for SSP. Now, the good news is software is amazing, so you don't have to remember all these daily rates, especially not the unrounded ones. Your software will do all of that heavy lifting for you. But this is really good to have. Print it out, have it on your desk, and you can see the daily rates for statutory sick pay from the 6th of April. So let's move into the first change that's coming then. It's the removal of the waiting days. So all of the examples I'm going to talk through today is going to be based on someone who works Monday through to Friday. So a full-time worker working your core working days. So first thing to look at then, for people who are taking sick on or after the 6th of April, the new rules apply. We've got a hard cut-off and it's from the 6th of April. So for this individual, they call in sick on Monday the 6th and they get SSP from day 1. So this individual will get that full weekly rate of SSP. What's going to happen with pre-existing absences is it's a clean slate from the 6th of April. So let's take a look at this example where someone was sick the Friday before. So Friday the 3rd of April, someone's called in sick. They will serve 1 waiting day because their sickness started under the old rules. However, come Monday the 6th, they'll get paid. So that individual is only serving 1 waiting day. Come the 6th of April, they get paid SSP for that day. Now, Amanda touched on company sick pay, and it's really important that what we are doing prior to the 6th of April is looking at our software, looking at pay elements and parameters in your software, and ensuring that they have been updated. Now, if you or your clients pay an element of company sick pay, you're allowed to pay SSP as part of that company sick pay daily rate. So let me give you a really simple example and we'll use rounded rates. So So let's say an employee's daily rate is £100 per day. If SSP for one day is £20, your company sick pay would be paid at £80 to create 100% pay for that individual. If that is the case, you need to ensure that your company sick pay elements and parameters have been updated accordingly. So SSP is being considered from day one of absence. Now, software is amazing. It's a wonderful thing. And this is a statutory payment. So your software provider will update the parameters in the background so the weekly rates are the same. However, it's your responsibility to test that the software is working the way that you want it to. So please do test this prior to the start of the new tax year. Now, Amanda also touched on the fact that some people are actually going to be a little bit worse off. Well, the good news is that's not the policy intent here, and the government have provided some transitional arrangements to protect the individuals who would see a drop immediately from the 6th of April. So I've categorised these individuals as lower earners. These are people who are going to be earning between £125 and £154.05 per week, to be precise. So that's because they're going to earn the lower of the flat weekly rate or 80% of their average weekly earnings. It's normal weekly earnings stated in legislation. What we know that as is average weekly earnings. The reason it's going to impact this cohort earning between these values is that when you look at 80% of their average weekly earnings, it's going to take them below the flat rate of SSP as it stands today. So, as an example, let's have a look at this individual who's earning £130 per week. If they're off sick now, they'd be earning £118.75 of SSP, the flat weekly rate. Come the 6th of April, if we didn't have transitional arrangements, they'd drop suddenly to £104 per week of SSP, and they've been protected from that. Now, thinking about average weekly earnings, let's touch on that, and then I'll take you through some working examples of the transitional arrangements. So I'm going to do a whistle stop here and break it down so it's very so it's as clear as possible without going into the jargon. Average weekly earnings, that's going to be based on the employee's earnings in a relevant period. All you need to know about a relevant period is you look at the payday prior to the person's sickness and you count 8 weeks back. It's as simple as that. Obviously, it's not as simple as that in practice because you may have weekly paid, 4 weekly paid, monthly paid. But the basis is the same. You're sick now. What was my last payday? What were my earnings in that payday? And 8 weeks back. There's guidance on gov.uk that kind of deep dives into how you undertake those calculations. So do go and have a look at those. DWP have confirmed that when calculating SSP, if the payment includes a fraction of a penny, it's going to be rounded up to the next whole number of pence. And this is going to be a key one as well. Where there's a PIW and it's linked, so that means there's 2 sicknesses that fall within an 8-week period, the average weekly earnings that was calculated for the first instance of sickness will be the same average weekly earnings calculation used for the linked sickness. Now, we've raised this with DWP that it could be that someone's done loads more hours and earned lots more money in between those two periods of sickness. Should actually be there be a protection there. So we've put that back to DWP. Once we know the answer, we'll be publishing something on the website. So CIPD members, keep an eye on our website. CIPP members, you'll get emailed all the latest news. So transitional period, so this is where we don't want to see a drop. So the new absences from the 6th of April, again, that's clean cut, new absences on or after. These individuals will now be receiving 80% of their average weekly earnings. However, if someone was sick prior to and at the time of the 6th of April, and they were in receipt of the full weekly rate of SSP. So I've highlighted that here. They're on the full weekly rate here. They were entitled to a full weekly rate. The transitional period means that come the 6th of April, they'll be entitled to the full weekly rate of the new tax year's rate of the 12325. Now, they're only going to be in receipt of that full weekly rate for that period of absence. As soon as they return to work, or they've exhausted their SSP entitlement, or their contract of employment ends, that's when the full weekly rate ends. Any new periods of absence will refer to what we've got up here, 80% of average weekly earnings for SSP. Now, I know that I'm pushing my time, but I've only got one more slide to talk through, and then Rachel, it's over to you. So let's have a look at our newly entitled workers. So that's people who have not received SSP in the past because they're under the lower earnings limit, but now they'll be entitled. So again, like we've seen on every example, new absences on or after the 6th of April, they will start to receive average weekly earnings. So they'll get 80% of their average weekly earnings as SSP. For anyone who was sick prior to and covering the 6th of April, they will have had no SSP here, but come the 6th of April, they will be immediately entitled to it. So from the 6th, if someone's off sick and they weren't in receipt of SSP, they will become entitled from the 6th. So here, again, we've got 80% of average weekly earnings as SSP. So the final thing I want to share with you is I've done a whistle-stop tour. I've gone really high-level overview. If you want more intricate details, if you want more worked examples, the CIPP are running 1-hour webinars on this exact topic. You can use the link on the slide to access that. My key takeaways for you today is check your systems. Make sure everything's working the way that you want it to, specifically if you've got elements of company sick pay that you pay to your workforce or to your client's workforce. I'll be coming back to answer any questions at the end. So that is all from me. Rachel, over to you.
Thanks so much, both Amanda and Sam. I think by now we're all appreciating that there's a lot of technical detail for people to absorb and get their heads around in view of those changes that are coming through imminently around statutory sick pay. So I lead in the public policy team at CIPD for health and wellbeing. So what I'm going to do in terms of standing back a little bit really and looking at, well, what are the implications and the broader impact for people professionals in terms of managing sickness absence, but also supporting health and wellbeing in the workforce so that you can hopefully contain and manage sickness absence, avoid unnecessary sickness absence. it's undoubtedly quite a challenging environment at the moment in terms of people's health and work. So on the first slide, I'm going to just highlight that sickness absence, as Amanda has alluded to, is a cause for concern at the moment. This is our Health and Wellbeing at Work survey report that we published in the autumn. I think most CIPD members will be familiar with it. It's a sample of 1,000 employers in terms of what their sickness absence levels and health and wellbeing patterns are. And it's a robust piece of research. And we can see that on this graph, if you look at the orange line, in terms of the number of days taken on average per employee per year, it has shot up to 9.4 days per year. And that is a big increase, the biggest in 15 years, as far as our research can tell. And nearly, nearly 2 days more than after the pandemic, and a big increase from 5.8 days since just before the pandemic. So it's really gone up. So it's a cause for concern. Now, obviously, the regulatory changes that Sam has so brilliantly taken us through in terms of that complex technical detail, obviously there are very immediate implications for HR professionals and all organisations, including payroll professionals and organisations, from those immediate changes. They are urgent and need to be taken on board immediately, but also there are slightly broader implications as well. Even if you do pay occupational sick pay from day one, so you might think, oh, well, there isn't an immediate impact. There still will be in terms of the longer, more strategic considerations, such as it could have been a really great health-related benefit to provide statutory occupational sick pay from day one, but that will no longer be a differentiating factor in terms of your overall recruitment and retention strategies. So it is always an opportunity, even if you might not feel immediately impacted, to think about the wider approach in terms of how you support people's health and well-being and avoid unnecessary sickness absence. So that should be the guiding principle. So if we just look quickly at the next slide, we can see what the top causes of short-term and long-term absence are across organisations broadly. And we can see that it's always the case that minor illnesses is the main cause of short-term absence by far, but we can see mental ill health by far the main cause of long-term absence. It's also a cause of short-term absence, and we have stress as well, a cause which is psychological ill health, musculoskeletal injuries, high up the scale as well. Now, those are national figures, and it's very helpful to benchmark your organisation. But really what's important here is to understand what the main causes of sickness absence are in your organisation across your workforce, because they will vary enormously in terms of sector, roles, occupations. And of course, there will be times when people do need to take time off because they're unwell. But by having the right policies, practices in place, it should be possible to support people's health needs in a very supportive way, while also having clear understandings and expectations across your workforce that you do not accept unauthorised absence and you want to discourage inappropriate use of sick pay schemes. So on the next slide, I've just got some guiding principles around this that I think every organisation would benefit from looking at. So, does your absence management framework, your policies, your training, your procedures, and so on, first of all, do they encourage a genuine reporting climate where physical and psychological health are given equal standing, as I explained in those causes of absence, and Do you foster a culture in your workplace where people feel safe and secure to talk about health issues? Because a lot of people can feel quite nervous about sharing information about their health. And if you don't know, if your line managers don't know why people are off, there could be unexplained absences. We want people to feel that they can talk about the real issues that are affecting them, because then the organisations are able to offer the right support. So it's important that you've got that feeling of what we call psychological safety. And then secondly, be very mindful of your obligations as an employer in terms of the Equality Act, where somebody might have a disability or long-term health condition. It could be, especially with the very high number of people with ongoing health conditions. There's nearly 9 million in this country, and most of those people are working still, but it could be that they need to take short-term absences because of a fluctuating health condition or a disability. So organisations need to have that flexibility, that support in place to provide not only support to that individual to enable them to carry on working, but also not to penalise somebody that could be discriminatory. For example, if you're using a trigger system as part of your absence framework. And then, very important, do you have effective reporting ongoing so that you know what is happening in terms of absence and attendance in your organisation? So are you looking at the data? Are you monitoring? Are you analysing the data and looking beyond the data in terms of sickness absence? Are you looking at it also in conjunction with other employee data like engagement surveys? What lies beneath the raw sickness absence data? Is it effectively capturing the real reasons for sickness absence in your organisation? But use qualitative data as well. So line manager information is very important, that management data. So we've got very good guidance at the CIPD for members. We've got very good fact sheet around managing and monitoring, measuring sickness absence. And we've got a whole suite of absence management guidance. And then fourthly, think about prevention. It is not within the gift of employers to prevent a lot of disease and conditions that people might develop. Of course it isn't. But are you fully evaluating the impact that work might be having on people's health? Our Good Work Index at the CIPD last year showed that a quarter of employees said that work was having a negative impact on both their physical and their mental health. And that is not good, is it? The role of employers is to mitigate or eliminate the risks that could arise to people's health from their work. And that means psychological health. So are you carrying out stress risk assessments, for example? And it also means physical health. Think about the high level of absence due to musculoskeletal injuries. So prevention should be your guiding principle as well. And then following on from that, are you thinking about and implementing early intervention to help mitigate problems? So not waiting until somebody's been off sick for 4 weeks and health issues and absence have already escalated for a referral to occupational health, or providing early access to mental health support and other expert help, employee assistance programs, counselling, whatever health support you can provide. Think about offering it at the earliest possible opportunity. And then moving down, are you offering in a proactive way work adjustments? Of course, there's a statutory duty, it's explicit under the Equality Act to make reasonable adjustments if somebody has a disability. But are you offering them beyond that? Because that approach could reap benefits in the longer term by offering some flexibility. It could be minor adjustments to someone's role, their working arrangement, because it could help manage the impact of somebody's health symptoms on work, and then help to keep them in healthy work and avoid unnecessary sickness absence. So really think about being proactive in that space. And then last but one, Do employees in your organisation know what is in place in terms of sickness absence policies, what is expected of them if they are off sick, what benefits are available to them in terms of sick pay, but also other support that could help them stay in work and come back to work as well. So finally, I'm going to move on with my last slide to this point. It's about the role that line managers play for supporting people through that interaction with work and managing any health issues and also sickness, absence and return to work. They are your linchpin, line managers. And yet we know only around half train line managers specifically around absence management in terms of supporting health and well-being in their teams. But if you put that investment in, it could play dividends. So they do need that education. They do need to feel confident to have those conversations. They need to feel skilled, and also moving on into building trusting relationships. They are integral to creating that safe environment where people feel they've got the confidence to share sensitive information about their health. So it's about their behaviour as well, and not just knowing what the procedure is. And then having those sensitive one-to-ones and feeling confident about keeping in touch. We know a lot of line managers, because they don't want to pressure people when they're off sick, but actually it's really important to maintain that employment relationship, but it needs to be done in a sensitive way with that individual if they are off sick and not feeling well. So we've got really good guidance around that as well, how to be supportive and help support a sustainable return to work. So if we move just very briefly onto the next slide, I will leave you with this because I think you've got lots of questions. Effective return to work. So return to work is often seen and implemented as a one-off event, but actually it so isn't. It is a journey. And I use that word with intention, because first of all, it is about maintaining communication when someone is off sick, planning for that return to work. What would help you? What do you need? What about a phased return? It could be that some people come back day one after sickness absence, depending on what the issue was and how long it was for, and they're ready to go. But it could mean that actually they need some extra support, some adjustments, a phased return. It will all depend on the individual situation. So prepare for that return and then support the individual and the manager, if you're HR, to make that sustained return to work so that they don't feel the need, feel overwhelmed and then go off sick again. You know, how it's managed will be really instrumental there. And then just ongoing support when somebody returns. So I'm going to leave you there. We've got lots of guidance on our website, and I'm sure we'll have some links at the end, but I think you've got lots of questions, so look forward to hearing them. Thank you.
Many thanks for that, Rachel, and also Sam and Amanda. And yes, we have got quite a lot of questions. So perhaps this could be for you, Amanda. We've got a question about what is the impact for organisations in Northern Ireland?
Well, Northern Ireland will follow. We haven't got they will follow the suit with the UK law, and they will be coming in at the same time, usually come in at the same time with this, and we expect them to come in at the same time with this. So it's got to go to Parliament, but it will be coming in at the same time, I understand.
Right. Okay. Nice, easy one.
Yes, that was an easy one.
Next one. Perhaps again to you, Amanda. Can statutory sick pay be withheld if a self-certification is not completed, assuming that the completion of the self-certification is part of the sickness policy?
Well, I think I did answer. So this question came up on our webinar the other day, excuse me, and it was talking about withholding pay, which we say hold with, you know, with caution, but they can self-certificate. But and I think I read this question out, which says, can SSP withheld if the employee does not follow the absent reporting procedure, which I think it goes back to what you've got in your policies and procedures. But I would say yes, in limited circumstances, employers can enforce reasonable reporting procedures, but SSP should not be withheld automatically. It's all about a conversation. Everything in HR, I believe, starts with a conversation to fact find. That's why we're really pushing the return to work interview, because why didn't you notify? Why haven't you done that? Haven't you complied? And we're talking about two separate things here as well with return to work. We're talking about sickness procedures, but we're also talking about conduct. When you've got procedures in place and people don't choose to follow them, that's an, you know, we're going to talk to you about your sickness, but we're also going to talk to you about your conduct. There may be a reason why they haven't advised or informed, but I would have that conversation, ask the employee why, have they got a genuine reason, consistency of application throughout as well with everybody, be careful of discrimination or unfair treatment, treat everybody the same. You've got to be, I always use the word with consistent and employment law and HR. And as I said when I answered the question earlier, a blanket no report, no pay approach is risky. It's all about fact finding, it's all about return to work interviews even after half a day, and asking people about reasons for sickness, but also if they didn't inform you why, or and some people are reluctant for you to access medical records, but we're going off on a tangent there because I could get carried away.
Another question is around, can a company use 7 qualifying days for all employees? The questioner said that 95% of their workers do not have fixed working days. The days off will change from week to week. So what would you recommend there? And what would then be the implications for calculating this through payroll?
This is not for me.
First for you and then for Sam.
Okay, so first of all, what I'll take is the employment law side and the casual worker side, which we now know casual workers do qualify for this SSP. And I always like to clear up whether somebody is definitely a casual worker, what their contract is, the right contract in place. Self-employed workers don't qualify for SSP, but what I can say about that is a lot of people think their employees are their client, the arrangements they have, the people are self-employed, but after delving into it, I often find that they're not self-employed. They actually are either a worker, casual worker, or an employee. So I'm going to repeat first of all to clear up with everybody, because I know I want you to double check. A genuinely self-employed person will have a contract for services in place, and it will say something like, my name's Amanda Chadwick, I have an agreement with CIPD, for example. I don't just work for the CIPD, I work for other people, and I sign that. I can send anybody else from a place today. I can charge what I want. I'm responsible for my own tax and insurance. And that I am genuinely self-employed. So I think we need to clear up that one first of all, clear up the fact that casual workers now are entitled. I know that, and also just clearing that up, and I think that covers my side of the question, I think. Does it?
Yeah.
Yeah.
Well, okay, so from a pay point of view, casual workers, as long as they're employed, have always been entitled to SSP if they hit the earnings value.
Yeah.
The qualifying days is what's in question. So qualifying days, it's set out in the SSP regs 2015, I believe, and it's reg 5, and it essentially says that the qualifying days will be the day in which the employees agreed to work. So that might be set out in a contract. It could be what's set out on a rota. If there is no such agreement, then you'd take a Wednesday as the qualifying day. So everyone would always have at least one qualifying day in a week. And remember my first slide that I set out, that big long table. At that point, if you've got one qualifying day, your daily rate is the full weekly rate of SSP. Or the third option is that you use every possible day that that person could have worked. So I think, Charles, this individual's asking, can they use that third option in that there's 7 days, 7 qualifying days for the whole workforce? I would suggest that it's looked at on a case-by-case basis. I think 7 days for the whole workforce as a blanket is risky, because unless employees know that, they might be only ringing up and saying they were sick for what they presumed they were working that week, say Wednesday, Thursday, Friday. They'd only get 3/7 of a weekly rate of SSP at that point, if actually they've got 7 qualifying days. So touching on HR now, but communication is key. I don't see a reason why they shouldn't. I don't think it would be best practice, however. I would suggest that everyone looks at it on a case-by-case basis, especially when contractual days of the week are in question.
Great. Another following on from this question, I suppose another one is around the rights for temporary agency workers. How are they going to be treated? Do they also have a day one right? Amanda, again, do you want to?
Yeah, so the agency workers will be paid by the agency, do you mean by, are you on about agency workers as in as they're usually classed as employees, so they would be included, and the agency is normally responsible for the payment.
Right, so the agents have to worry about this rather than the employers
Yes.
who are employing them.
So whoever pays their wages, and so yeah. So that's who would pay it. So in my interpretation, the agency worker, depending on the relationship of who pays the wages, the agency worker would be paid by the agency.
Great. So Samantha, in terms of calculating average weekly earnings, is there a formula that employers should use or could use?
Not a formula, so to speak, but I said there was some really good guidance pages. I'm going to put them in the chat. So I'm going to put some links in the chat so people can review this, these 2 pages. The one thing I would also recommend is the training course that I put a link to as well. That would cover that in detail. It would take you through that formula, so to speak, Charles. But take a look at those pages in the interim.
Another one, Samantha, is a bit technical, but if a company sick pay scheme entitles employees to receive the first 3 days of occupational sick pay once in a rolling 12 months period, how will the removal of statutory sick pay waiting days affect this, if at all?
Okay. I don't think it will, because if someone's being paid company sick pay, which is full pay anyway, they'd be paying that full pay. If it's only limited to 1 3-day period per rolling sickness, what it will mean is that every instance of sickness, that employer now needs to pay statutory sick pay from day 1. And I don't know, Charles, if this is on your list of the questions to read out, but there's a lot of confusion around the period of incapacity to work and whether people still need to be off for 4 days in order to be paid from day 1. No, they don't. I can be sick for 1 day and I will receive SSP for that 1 day. I don't need to be off for those 4 full days anymore. It's paid from day 1. It's as simple as that. I'm saying it frankly to get the message across. I'm sick for 1 day, I get paid for 1 day. I don't have to be off sick for a set amount of time anymore to receive SSP. So I wanted to address that if you weren't going to get round to it, because I know a lot of people have asked similar questions.
Another question is for the transitional rate. If a new period of sickness occurs within the PIW period, would the rate be at the standard rate or at the 80% rate?
So the transitional periods are so people don't decrease. So if they are in receipt of the full weekly rate of SSP now, so I'm thinking this tax year, so at the 3rd of April, come the 6th of April, they will automatically be uplifted to the new full weekly rate. It's a really good question as to if there's then a linked period after that, what the rate would be. I don't have black and white solid information on this, but my gut feel would be you will need a recalculation. You'd need a recalculation, and any new absence after the one that transitioned into the 6th of April would then be paid at 80% of the average weekly earnings. I will make a note to ensure that we pick that up with our colleagues at DWP.
Great, super. Because of that, there's quite a lot of questions around when SSP is payable and the PIW period as well. But I think what will happen is that at some point, even if we don't get a chance to go through all of the questions, you and my CIPD colleague will go through these questions, bunch them together and kind of give some response to that. Another question is about the slides. Yes, you will be getting the slides later today. So I'm busy going up the all the queries. Another question is, given that linked periods now can consist of a single day, does the 28 week severe linked periods still apply?
So your entitlement to SSP is 28 weeks of the full weekly rate of SSP. So the 28-week period for payment still remains. You've still got the 3-year cap, which I think is what this person is referring to. So you've still got your 28 weeks of pay eligibility, and you've still got that 3-year cap of entitlement for linked periods. There's obviously some work that we need to do at the CIPP around the period of incapacity to work and those linked periods, because there's lots of questions about that. So I will take that away as an action, and we'll put some news articles out there to upskill the industry. Anything that goes onto the news pages at the CIPP, non-members can also access that.
Great. We've dealt with casual, we've dealt with temporary. What about employees who are on 0-hour contracts? How would you calculate their average weekly earnings for those types of individuals? And also, is there a minimum length of service before statutory sick pay can be paid? So would you like to answer that, Amanda? Oh, you're on mute.
Sorry, I was just looking at some of the questions myself, actually, and I was going through it because a lot of the questions that are coming through, going back to what Samantha said, they're applicable to people's personal contracts they've got with the staff, and sometimes I'd like to see the contract to give advice before, I just want to clear that one up when we talk about agency, self-employed and casual workers. Actually, the SSP and calculation for casual workers isn't something I get involved in, so I can't really answer that question. I give the overview on the HR and the contracts, and the calculation isn't something that I would work out. So I don't know, Samantha, if you know the answer to that one.
Yeah, so your average weekly earnings, it's going to be that relevant period. So you're going to look at the 8 weeks of earnings prior to the period of sickness. So this is where I tried to say it quite crudely. If I'm sick now, what was my last payday? What did I earn? And what did I earn for the 8 weeks prior to that? That would give me my average weekly earnings. And then 0 hours, there's a lot of confusion around, well, if I'm on a 0-hour contract and I ring my employer up and say I'm sick, what am I sick for? Because actually I'm not contracted to work any hours. But this is where we go back to, if I'm on a rota, they're my qualifying days. If there's no agreement, you could take a Wednesday. So I've got at least one qualifying day per week, or every available day that I could have worked. So I work in a retail store, it's open 7 days a week. I could potentially be off for 7 days in any given week. So it's still average weekly earnings calculation as any other person, and then it's looking into your qualifying days.
Great, thanks for that. Unfortunately, that's all the time we have for question and answer session today. But as I said, colleagues will be looking at it after the session closes and we're putting out answers. So just to again say that the webinar will be available on demand later today, and you'll also get the slides. Don't forget the CIPD's wellbeing support for members with a 24/7 free phone helpline for members in the UK, Ireland and Dubai, with live chat, WhatsApp or email staff by accredited counsellors and physiotherapists. Hopefully today's session hasn't encouraged more people to be contacting that helpline. And we hope to see you on other CIPD webinars again, please. So, check our website for future topics, and perhaps this time year we will be together again as we explore how HR and payroll teams need to work together when payrolling benefits in kind from April 2027. So again, thank you very much and have a great rest of your day.
Thank you, Charles. Thank you, Amanda and Rachel.
Yeah,
Take care.
thank you, everyone. Bye.
Bye.
Thank you. Bye-bye. I've never been so nervous in my life.